Hello, good evening, everyone, and welcome. Thank you so much for joining us tonight for College Bound Supporting Mental Health Away from Home. My name is Shilpa Kulkarni, and I'm the president and co founder of Shiv's Third Eye, a New Jersey nonprofit established in memory of our son Shiv, whom we lost at the age of 14 to mental health, to suicide. Shiv's Third Eye was created with one core belief: mental health education and awareness must begin before the crisis. Tonight's panel is a vital part of that mission. As families focus on college admissions, academics, and logistics, one critical piece is often under-discussed: emotional readiness. This conversation is meant to help parents and students prepare not just academically but emotionally. Tonight's discussion is just not theoretical, even for me either. It's very real, as I'm a mom of high school senior who is getting ready to fly the nest. I'm honored to be joined by two highly respected clinicians who work closely with adolescents, young adults, and families navigating this exact situation. Dr. Turowski is a licensed clinical psychologist, founder of Quiet Mind CBT in Chatham. Joining her is Alison Steiner, a licensed clinician, a clinical social worker at Positive Developments in Melbourne. I will invite Dr. Julia Turowski and Alison Steiner to introduce themselves and briefly talk about their experience. Thank you. Dr. Turowski.
Hi, I'm Dr. Julia Tarofsky, and I have been a clinical psychologist for almost 30 years. I have a specialty in anxiety disorders and mood disorders in adolescents and adults. And I started my career in research and academic settings. I used to run the Rutgers University Anxiety Disorders Clinic, and my research focused on understanding the difference between healthy worry and unhealthy worry, and how some transitions present in adults and become challenges. I love supervising doctoral students and graduate students in their journey to become clinical psychologists. And it's my pleasure to join you because spreading awareness about mental health and offering education to the community is a passion of mine. And I am really happy to be here, and especially lately, because I would say I've spent the last 5 or 10 years really focusing on working with college students. And so right now I kind of see students all across the country and support them in their adjustments, and have lots of experience and tips and strategies for both parents and kids in terms of what they can learn from, my experience.
Thank you. Thank you so much. Alison?
I'm Alison Steiner, and I'm so happy to be here as well. Thank you so much for inviting me to join. I also have been a social worker for about 30 years. I've worked in schools and in private practice, and also supervising graduate students, social workers for about 19 years, and really focus on working with older adolescents, young adults, and adults. But my favorite area is helping with this transition from high school into the college experience. I believe that this is such an important time, and it's a really challenging time. The identity formation that's going on, the learning how to manage difficult things, and figuring out, are we doing this the way my parents told me to do this, or am I doing this in a new way? Being confronted with the values of peers, and really learning how to stress test a safety net has just been a really important part of the work that I've done with these young people. And I do tend to work using acceptance and commitment therapy, which is really helping people to feel a growing ability to tolerate challenge and frustration, to tolerate difficult emotional experiences, while really being able to gradually transition from tolerating to being able to robustly connect with their values, connect with the things that are important to them that help them to manage in difficult situations. So I'm really looking
Yeah.
forward to talking about the questions that we have and seeing how we can really work together with families.
Thank you. Thank you both. Yes, it is kind of, and as I said, like I'm sort of experiencing it in some ways with my child, and it is exciting and it is nerve-wracking time as well, both. So, one of the things that I guess the very first thing that comes to my mind when we say college bound, college ready for kids, what does it actually look like beyond the academics? Like, obviously, academics, they get in wherever they belong, wherever they want, and that's all fine and dandy. But what does college ready, like, how would we know, or how would the child themselves, when they are, how confident, how would they feel confident that they are ready for college?
Well, I would say that college readiness, it's really self-management under stress. It's not necessarily that you can handle all the stress so much as that you can recognize when you are feeling overwhelmed. It's then you can engage emotional life skills, that you can manage unstructured time, tolerating discomfort, and recovering from setbacks without spiraling. I think it's a lot of what we really want to do is try to help with flexible thinking and understanding that college may be very, very difficult, in different areas at different times, but understanding that you can tolerate that and that when things don't go as expected, help is there.
Yeah. What do you think, Dr. Torosky?
I think that's absolutely correct, and I would just expand the answer a little bit and say that what we're looking in children, adolescents, and adults is how they negotiate developmental transitions. And the way I think of a developmental transition is kind of the hermit crab that needs to leave the little shell because it's too tight, and then he's naked and in danger, and he has to run over and kind of get into the next shell, which is big and cavernous and potentially scary, and fill it. And so I think when you had Dr. Friedman and Dr. Miller, there was a discussion about transitioning from childhood to adolescence.
Right.
College transition is shifting from adolescence to young adulthood. And we're looking for normal and healthy signs that the teenager is making that transition in a successful way. Are they becoming more independent? Are they taking on more responsibilities? Are they able to negotiate conflict? Can they speak to their teachers and advocate for a better grade on a paper? Can they spend some time away from home? Can they tolerate being home overnight without the parents being away? And are they interested in going to college? We live in an area where lots of kids go to sleepaway camp, and there's lots of parents that are really anxious to get their kids to go to sleepaway camp from second or third grade and, master independence for 7 weeks. And not every child is ready, and not every child is interested. I have kids that I work with that are desperate for autonomy, independence, self-sufficiency. They want to do their laundry. They want to regulate their curfew. They want to do their schoolwork without their parents present. There are other children I work with that don't have the same cravings. They're either really nervous about leaving, or they would like to live at home and maybe commute to local university, state university. And every child has their own healthy, appropriate, normal developmental transition. And I think that for some kids, taking a gap year or going to community college for a little bit, for them to mature, gain confidence, gain a sense of self, is a perfectly lovely and healthy and appropriate choice.
That is, yeah, that's interesting. So I think when you said that, yeah, not all kids are craving for that independence and, autonomy. absolutely. But there are kids who really crave for that, I agree. But as parents, you see in day-to-day life, if you are given that, if you are giving them that autonomy or the
Yes.
time scale, like time management, food management, anything that goes around with doing their laundry or keeping their room clean or whatever, you don't get the feeling, as parents, you don't get the confidence that they are ready yet. So how do we help them without having the difficult conflicting conversations that end up happening if you are trying to, because one is wanting something and another is actually managing that want, like once you are given that privilege or given that condition, how are they going to do? And do you see a lot of college kids that they would want and they would go, and then there are issues because they are not able to manage it?
Yeah, I think so. I mean, I think it's a dance between parents and students, and I would give the responsibility in a way that's shared. Sometimes when I'm going to fast forward and I'm working with older kids who graduate college, sometimes those kids have zero financial responsibilities and obligations and no budgets, and the parents fully fund them. And then they graduate college, get a job, move to New York, and the parents go, "You're on your own." And the young adult says, "But I don't know, can I afford, how do I pay my bills, can you help me, can you?" And the parents are like, "I've paid for college, you're on your own." And I think that I see this with transitioning from high school to college as well. I think that the push for self-sufficiency, independence, autonomy, increased responsibility, family obligations, I think those things need to occur naturally. And I think we as parents need to start those things as maybe at the beginning of high school, maybe even earlier. Is your kid walking the dog or are you walking the dog? Is your child making their own breakfast or are you making the breakfast? Are they making their own appointments for their haircuts and their dental cleaning, or are you making those appointments? Do you need to remind them that it's time to do their homework or study for their SATs, or are they studying for their SATs? I used to make a joke about the fact that, and we all do this, we hire college counselors to help our children prepare to prepare them for school. But I had this feeling when my own kids were going through it that if they can't sit down on their own and just fill out that basic common application
Yeah.
without a counselor, it would raise concerns and questions to me about their ability to then manage their academics in a really independent way. So I think similarly to the parents who sort of pay for everything and then say you're on your own, there are some parents who accidentally, with lots of love and lots of good meaning, do everything for their children and then expect this radical shift. Now you're on your own. You're going to eat really well by yourself. You're going to do your laundry. You're going to go to the library. You're going to negotiate when you see your friends and when you study. And I think that that's unrealistic. So I think it's on I think the parents need to sort of gently prepare by passing the baton maybe over the last 4 years of high school. And if they haven't passed the baton, sometimes it's not even that the child is not ready. Sometimes I see that the parents may not be ready.
I
It's
think
actually that. Sorry, go ahead, Alice.
just one of the things in support of what Dr. Trevelsky is saying is when these conversations are postponed, when these transitions are postponed, a lot of times they come off in a punitive manner as well. Parents will say,
Yes.
"Oh, wait till you get to college. There's not going to be anybody there to do your laundry." Or children are afraid to ask their parents. And it's one of the things that I talk about with children starting as early in senior year as possible is when are you going to have the conversation about what the expectations are about finances at college? There's many different formulas that families use, whether it's going to be, we'll pay for all of it, which is a wonderful thing. We'll pay for all of it plus your sorority and your entertainment, delightful and wonderful. Or we're going to pay for 3 years and we're going to expect you to come up with a fourth. We'll pay for everything except your entertainment. Whatever it is, this is a conversation that should happen. I believe it should happen in a very positive, realistic way. But I think somehow these conversations are framed in a way that's punitive for a lot of children. Like, well, you think you're going to get all this, or children feel that if they ask, they will either be somehow inviting the idea of a golden goose being killed, and that's, that it's a magical thinking that if I don't ask, the money will be there, or if I ask, my parents will be thinking that I'm being grabby or overly acquisitive. Um, it's not only money, I'm using that as an example. Parents saying, you have to now start picking up after yourself, or helping out with the laundry or something like that. These are positives. This sort of autonomy and independence, when started early and when framed correctly, are positives. It's independence. It's being a young adult. It's being able to live your life in a way that you're going to be proud of and feel good about at college. So I support what you're saying, and it's how these conversations are held is really important. That while this growth may not be as easy as it was to have me doing everything for you, it's really positive because you are now demonstrating your own autonomy and independence, and that's a great thing. And of course, I'll help you fold your socks from time to time, but you have to start doing your laundry. And we can fold socks together, while we're watching our favorite show. But this is something you're going to do, and this is something I'm going to do, and it's going to be the same thing with other things. This is ways of helping to build this so that it doesn't feel punitive.
Yeah, no, it makes sense. And I think what I'm thinking now, that coming from how we are getting them ready for college, for even the independence life or independent life that they are going to have, how do we actually, how can we take, what kind of concrete steps we can take? Because obviously, even though we are going to try and do all the right things, or we can prepare them as much as possible, being part of being independent and part of being alone, being in college under so much of different stressors that are there, like social, emotional, whatever, they are probably going to face some sort of distress from time to time or whatever. How do we actually take the steps, like concrete steps, to encourage them even before the college starts, to take care of their support their mental well-being?
I think one thing we do is what you did just now, which is predict it and expect it and introduce that concept. And very much along the line of what Allison was saying earlier about acceptance and commitment therapy, part of our job is to introduce the idea that struggling, suffering, and being uncomfortable are really beautiful and effective forms of inoculation and preparation for real life. And so I think predicting it, kind of saying, there might be really difficult moments. You may feel homesick. You might feel lonely. You may struggle. You may dislike some classes. You might find it too difficult or too easy. You're going to struggle, and what are we going to do about that struggle? I think just predicting and normalizing the struggle itself takes the sting out of the fact that it's really scary. The other fun thing I talk about with high school students is that college is actually very brief in the sense that you go to school, it's a 3-month semester. There's parents' weekends, you go home for a week, there's fall break, there's spring break, then you're home for 6 weeks or 8 weeks, then you're back for 3 months. You're really in school, for about 5-6 months out of the year. So there's lots of opportunities to come home and be cozy and be comfortable. And that it's also okay to have that stumble and to predict the fact that there might be some academic challenges and social challenges, and they're not a sign of failure, they're rather a sign of growth. And one of the things that I think we all see, because we live, in the North Jersey area where kids are very academic and very competitive, there's 2 things that occur that I think are challenging for them. One is just going back to the practicalities of life. They're taking AP classes, they're playing sports, they're volunteering, they're doing all these extracurriculars. We tend to take the practical stuff off their plates. We say, I'll do the
Very
dishes,
true.
you study. I'll
Very true.
walk the dog, you study. I'll go get you extra underwear, you study. And I think that's a mistake because I think we're making them very intellectually top heavy. They are brilliant and they're working a lot harder than I think we did at their age. But when I talk to college counselors, they are a little more incompetent in terms of like adult skills like cooking and taking care of themselves and all those kinds of things. The other thing that I see is that are really hardworking, brilliant children who are perhaps at the top of their class or in the top 5 or 10% of their class, they get their wish. They get into fantastic, rigorous universities where they are no longer at the top. They're in the middle. Sometimes they're at the bottom. And I think it's really hard for a straight A student. I had a boy I was working with that was brilliant, valedictorian, won all the math competitions, and got into MIT. His dream came true.
Wow.
Started with Calc 2 or Calc 3 because, of course, he had all the calculuses and almost failed the class. Got a C in the class and had a complete crash because it's really hard to be in a school where everybody is gifted and everybody's brilliant. So sometimes I see kids getting their dreams come true, which is wonderful, but that also requires an adjustment. It's a very humbling experience. And so I think predicting all those things, normalizing them as parents, kind of saying you're not going to get the brass ring. You're not going to get A pluses. You've done the hard work of getting into an excellent school. You're there to learn, to grow, to fail and succeed, and that all of those things are a form of success and development. And I think it's a beautiful message for parents to give their children so that they're not going with that same expectation of like forever I have to be an A plus student.
Correct. Yeah, no, that's fantastic. Alison, I have a follow-up question on that because I feel we are talking now at this point is more like a senior student who is going away to college. How do we take care of, or how do we start getting these kids being aware of their own mental well-being, starting from freshman, starting from sophomore and junior year? Like, how do we do that as parents so that it doesn't come crashing? Like, it's I think my daughter is not going to like it, but we joke about it at home that once whatever the time has come, like next few months, we have to start a boot camp for her so that we can get her
So,
ready for many things. That, but it shouldn't have come to that, right? We should have
right.
started probably freshman year.
So really, I mean, it should, this is something that should ideally be something that we are always doing, not only modeling for our children, but having the experiences ourselves. Our children aren't the only ones that should be having these mentally healthy conversations as well. And so modeling that for our children. So naming feelings, that you yourself, as a freshman, when you're with your freshmen, you yourself are articulating what these feelings are, and nuanced, complex feelings if you can. Building the emotional literacy of having a vocabulary to describe things, and then tolerating mistakes. When your child makes a mistake, you tolerate it and you discuss it, and that you practice, you articulate for them a mistake that you made during the day, a frustration that you had, a fear that you had during the day, and making this sort of conversation normalized, so that they can then see and practice asking for help. One of the greatest protective factors for any child, any adult, in any situation is knowing that help is available, knowing that help is something that can be asked for, that bad situations happen, and that you can ask for help and it will be available. As a child is growing, I completely agree with Dr. Turovsky saying that we should be giving them more than just academics. The realization that you are not just your grades, and that you are a member of this family, and that we have expectations for you of being a good person and helping each other out, and that your success in this world is not only determined by what your grades are. Your success is also on, did you help your grandmother? Did you remember to call? Were you a kind friend at school? And it's not only ribbons and accolades, but it's the gratitude of the people that are important to you in your life. And that these intangibles are really important. We want kids to also, so the phrase that I use with talking with parents, and sometimes this is really difficult for parents, but I say, struggling is good, suffering, not so good. We don't want people to
Right.
sit in a stew of suffering, but struggling with something, finding it hard, finding it frustrating, and tolerating that and being able to, if not figure out a solution, figure out that they need help and then accepting help. So it's two different skill sets, and articulating this,
Yeah.
narrating this for your child, that you can ask for help and then accept the help. It's really important, and helping them to then see, if they can by the time they're a junior, problem solving skills. And I remember a problem as a junior. I remember literally my father handing me an atlas and saying, get us to New Hampshire for this college trip. And
Rand McNally Atlas.
like literally handing me, and I'm saying, but wait, what happens? It goes off the page. And him laughing and saying, you're gonna have to figure this out. And he helped me. That's a problem that doesn't really need to be solved so much now. But the entire, helping them to figure out what colleges should we be looking at. And then accepting disappointment as well along the way. And that, is something, we should all have the incredible luck of being a phenomenal student with wonderful grades, wonderful SATs, wonderful extracurriculars, and then getting into the college that you felt that you deserved to get into. But not everybody gets that.
Yeah.
Not everybody has that happen. And so being able to tolerate and see that sometimes not getting what you want, it happens and it's not the end of the world, and being able to articulate that for them. So part of your job throughout their high school, but really even younger phase, is being the narrator of their lives, being the narrator of the feelings, telling the story out loud at dinner, saying, and wasn't that frustrating? And I was so upset with my boss, and it felt so unfair. I went and I talked to a friend, and you narrate your challenge and what solutions you did, and you listen for them and ask them, so then what did you do? And how did you handle it? And providing them with some vocabulary as well. It's definitely a great idea as they go along to have more and more independence. One of the lovely things about many of the towns around here is we have these downtowns, and so children can walk downtown. Children, by the time they're in high school, they can schedule their own appointments. They can shop for their, party gifts or something like that. It was something that I was very grateful for, that my own children were able to do. So having that sort of independence is great. But really, a lot of it is developing the emotional vocabulary, and some of it may be you narrating, just saying, wow, that was really awful. I saw how hard you worked. You really struggled. That sucked. I'm so proud of what you did. I'm so sorry it didn't work out. This is a real disappointment. This is a real disappointment. Let's see what else we can do, some other way of solving it, or just tolerating it, and so that they have these experiences.
Yeah.
I think there, I think there's also a difference. We haven't talked about it yet, but maybe we can, because this would be a nice moment. That we're sending different groups of kids to college, and the
Yeah, I was
advice,
going to ask you the same thing, but that is
and so the advice we give in terms of preparedness depends on sort of which group of adolescents and college-bound students we're talking about. So we have the reasonably healthy group of kids who've kind of have enjoyed good physical and mental health, and we have no expectation that those will be issues. They're not struggling with either an anxiety disorder or diabetes or asthma or some complication that's going to make it difficult. And those kids may need encouragement, cheerleading, opportunity for support, parents slowly phasing out, and some coaching. I think one thing we can always talk about a little later is assertiveness training, like learning to advocate for yourself, learning to tell your roommate that every time she borrows your clothes you're not happy. We could talk about all of that. That's one group of adolescents. So we have these physically and psychologically uncomplicated kids who are going to enjoy the path of typical development with a little support from us. The second group of kids might be the kids who have pre-existing conditions.
Correct.
And I purposely wanted to kind of blend physical challenges and mental health challenges because they all become a complication. So for example, if you have type 1 diabetes, or you have then how much drinking you can do in college is complicated. If you have celiac disease, you have to be really careful with your diet, and Crohn's disease, you can have an attack. And all of those things are much easier to handle when mom and dad are home, preparing the right foods, regulating the child's routine. Or kids that are struggling, adolescents that are struggling with mental health conditions and are already diagnosed and either getting treatment or in medication. So how do we continue all that good care, and what kinds of exacerbations do we expect?
Correct.
And then there's a third group of kids who are presenting without any particular challenges, but perhaps something is brewing, and perhaps they are biologically or psychologically vulnerable. And there's going to be a set of kids that will go to college and develop their first episode of some type of mental health condition because there's more drinking, there's less sleeping, there's less structure, and because, as you and I discussed, prior to this conversation, certain psychological conditions and certain psychiatric problems present an onset between the ages of 18 and 24. And so it's possible that your adolescent looks fairly healthy, but maybe there's some family background or some genetic vulnerability, and we need to be on the lookout for that first episode because it is possible they'll crash in college a bit. A, because college is more demanding and it's a huge change, but B, just because the biological ability may have kind of come to a head and cashes itself out like a 20-year CD.
Yeah. I think, Dr. Turoski, we also talked about, and I have seen this personally through my different people that I help or bring out the resources for, is the same set of people, that number one set that you mentioned, who are totally fine, they're well-adjusted kids, but sometimes these regular stressors, the roommate stressors, the drinking,
Yes.
those could trigger, they might not trigger like real serious, sort of mental health, onset of mental health disease or illness, but they could trigger technically some other
Yes.
issues with the mental health problems, whether they are temporary for a few months or a couple of years. And they might need help as well at that point. And I have seen quite a few of those cases. And that was surprising to me, that how many of these people who didn't seem like there was an issue at all, and suddenly this happened. And
Yes.
that's where I think that was one of the reasons why this conversation to me was very important, because most of the time, those are the parents who are least prepared to help their children and looking for resources. So, one thing that I was going to ask you is, what do you see the common mental health, like what have you seen sort of the common mental health challenges? I know you mentioned some of the stuff like, due to, or what are the stressors really that can actually exacerbate the mental health problems?
And I'm sure Alice and I both have
Alison,
lots
yeah.
to say about that. I mean, there's a tremendous disruption in normal routines and in the adolescent sleep and wake cycle. So you get to college and you're up to 3 or 4 in the morning. There's lots of drinking. There's lots of experimentation or dabbling with substances. There's a lot of marijuana use, and we'll talk about that in a bit. And there's this tremendous pressure to be socially successful. It's such a stimulating and overwhelming environment. And, no matter how socially successful one is in high school, you become a smaller fish in a bigger pond, and there's a demand. Some of the universities have first semester freshman year sorority and fraternity rush, which I think is not excellent timing because there's not enough time for kids to adjust. I remember my own son, I was rushing a fraternity. He was up till 5 in the morning doing things at the house and then studying for exams and then taking exams and then sleeping. I mean, there's such a biological disruption, and there's such an overstimulating environment. And also there's no limitations to socialization. So when we have our kids home, we kind of regulate a bit when they're out with friends and, when they're home and relaxing or with us. When you get to university, you are bombarded with a perpetual social onslaught, and you're continuously stimulated. So you're stimulated in your classes, and then you're stimulated in the hallway, and then you're stimulated with your roommate, and then you're stimulated in the dining hall, and then of course there's parties and all those social pressures. So the balance between time to self versus time to other, becomes broken. And so I think all those things make it easy for kids to develop some anxiety and depression. And the other reason I say anxiety and depression is that they're the most common of all the mental health conditions. So they account for the majority of the struggle for kids who are already labeled and diagnosed, and they're the most common mental health condition that can occur. So yeah, I think those are the things that are common. The other thing that sometimes happens that kids that are unprepared for is they're unprepared for the fact that they may not like their university or college, and that they might be disappointed, and that it's not the fantasy that they had before they left. And so there's some reality that maybe you haven't met nice friends, or your classes are boring, or it's too cold, or you wanted to go to the Midwest, but the people in the Midwest are not like you. And so I think, going back to what the parents can do, managing those expectations and predicting those things in advance, and recognizing that all of those stumbles could be a very normal, natural part to a future successful adjustment. And I always say to kids that the first semester is just you getting your feet wet, and all the friends you make, those things may crash, and all the classes you take, you may need to drop, and that we kind of need to treat that first semester as just an opportunity to adjust and to recognize what your vulnerabilities are. And we can certainly talk about how to get, once Allison chimes in, we could talk about how to get help, and whether to get help on campus or set that up, in advance.
Yeah, no, I think, Alison, my question is before even we go into the help, like sometimes when this happens, for example, some kids would come right out to the parents and tell them something is bothering them. They might have some sort of breakdown, whatever. So the parents kind of, obviously, as parents, we would get stressed out. We will try to figure out what help we need to give. But what happens a lot of times, the kids do not want to talk, or they feel like, oh, now I can't be a failure to, I don't want to tell my parents, or I don't want to worry them. It can be n number of reasons that they don't want to share it at times. How do, as parents, how do you really work with the children without overwhelming them, without pushing their boundaries, in terms of the check-ins or communication? And especially, how do you help them when the children are resisting talking or minimizing their struggle, and you might feel like there is something going on?
So, it's a great question. I think Some of this, I believe, is among the most important contracting that you can do with your child before they go to school. Um, you can explain, here are the things that we are going to expect from you. Um, you don't have to share every single thing, and we don't have to talk every day, but we do have to talk. I do have to know that you're doing well. I do have to understand when you're not doing well, how we're going to figure out a way for making things okay. I do need to be able to know roughly where you're at. I want to make it clear, and this is not going to be me trying to horn in on you in a way that prevents you from having independence, but really ensuring your safety. Um, so you can say things like, I don't need details. I just need to make sure that you're safe. And you need to understand that you don't need to go, whatever is going on, you don't need to go through this alone. Um, Sometimes it's just a calm, consistent presence, but that's something that's hopefully it's groundwork that you lay in the years prior. And then when they are at school,
Or
just
months
making
prior.
clear that this is an expectation that we talk, and it's okay if you don't want to tell me all the details, that's fine. But I need to just make sure that everything is okay. And that if it's not okay, then I don't need to know the details of your plan, but I need to know the outline of your plan. Um, I need to share, kind of tying this together with what Dr. Trofsky was talking about before. There's some great work done out of University of Texas. And a lot of it was focused on students who were first generation students, first generation college students. But it's
Yep.
really applicable across the board of this idea of belonging and the anxiety, the loneliness, the depression. A lot of times comes from a sense of not belonging. Dr. Trosky and I were talking about this actually a couple days ago, and I was talking about that constant feeling of imposter syndrome that so many freshmen have, even if they are in the middle of a social situation, they're looking around and everyone seems so much happier than they feel on the inside. Or many of them may not be in the middle of a social situation. But sometimes also in class, for the first time, they may get their first C or worse. They may get their first bad grade. And one of the things that they talked about with the work that's going on in the University of Texas is that this feeling of belonging is so crucial to a student's ability to succeed. And I know I heard it with my clients, and I remember it with my own children and myself. That time when I screwed up as a freshman, whether it was social or academic, and talking about it in the fear of telling my parents and their reaction to it, and the reaction was very, for me with my parents, was a very authentic reaction. They were upset. And then pretty quickly my father saying, look, I remember when this happened to me. We all screw up. I remember when I made this mistake. And my father said to me, I'm not paying for you to go to some fancy private school and get C's. You get another C and you're coming home to City College. And I went to, and he didn't use the word the writing lab because they didn't have that, but I got help. I got a tutor, I got help. I pulled it together. You're going to do that too. First semester, that writing class that everybody takes, college writing class, it's really hard. Or whatever the issue is. I'm using that as an example. It's really hard. You will make mistakes. There is help for you there. You are part of a long history, and whether it's not in our family, you are part of a proud history of people who screw up freshman year, who have real academic challenges, or who kiss a sorority sister's boyfriend, or kiss your roommate, or have an embarrassing substance use hopefully not dangerous, but make mistakes. You will get into situations where you've made mistakes. Help is there. You are not the first person to do it. If it's possible for you to share that members of our own family have done this and have recovered and thrived, even afterwards, it's going to be okay. You belong. You belong there. And always, the message is always help is there. Help is there. And it is a sign of strength to ask for help. It is a sign of strength
Yes.
to try to improve yourself. And you've seen me do it. You've seen your father do it. You've seen your siblings do it. Remember that time when, and they got help and it was okay. And it sucked while they were going through it. There's no doubt. It sucked while they were going through it, but they got through it. And you will too.
Excellent. Yeah.
I have a practical tip. I was thinking as you were talking, Allison. I have a very practical, simple tip for parents who are listening. And I think it's useful for all the kids that are heading to college, but maybe especially useful for kids who are struggling or have been diagnosed with either psychological difficulties or medical difficulties. And that is, you will have the pleasure and the luxury of visiting your child on campus multiple times. You'll be dropping them off, there'll be parents' weekend, there'll be football games you'll be coming to. One of the best things that you can do that will be helpful to your child is befriend your children's friends. So that means that you are really nice and bring an extra cupcake for the roommate.
Come with
And
the
you
goodies.
get cupcake and you get the roommate's cell phone number. You meet some nice boys in the hallway and you get their cell phone number. You kind of get a sense of like who does your child hang out with, and you get their phone number as well. So that when your child is burning with 103 fever, or they've passed out, or you can't find them, or they have depression and you're worried that they're not taking their medication, you have some other peers that you could check in with who will be the boots on the ground and do a little check for you. That is not a substitute for mental health counseling and therapy and psychiatry and supports. We could talk about that in a bit. But I personally found it really valuable to be able to call one of my kids' roommates and say, I'm probably being a nervous mother, but can you go find him for me, or can you check they're okay? Or, my daughter had really bad mono and was burning with a fever to the point where she couldn't make it to the health services center for help. And being able to reach out to some of those kids who hopefully grow to love your children and become good friends with your children, they could be phenomenal supports. And so I say to parents, don't be shy, be a little pushy, and get your kids' permission, of course, but make friends with their friends, because they will be an invaluable resource in an emergency.
That's fantastic. Yeah, that's a great tip, actually. Yeah, I have to remember that. So I think we have just the time check, we have about 12 minutes. So what should the families, whether the students or the parents, know about the mental health resources at the college campuses, and what are the common misconceptions in your experience? I have a few that I would share with you, but my question is really because you see a lot of college students. So what are those resources,
So,
and how can we?
yep. So, couple of things on, I think, the mental health side and also the academic disability side. If your child is struggling with or has been diagnosed with some learning disabilities or has attention deficit disorder, every college and university, in my experience, has an Office of Disabilities. And if your child has some accommodations and has been getting help while he or she has been in high school, it is really important and imperative to be registered with the Office of Disabilities prior to getting to campus. It can be done after they get there, but it's a process and sometimes takes a few months. It's especially important for kids I work with who have some medical issues. Maybe they need a medical single, maybe they need a dorm room close to campus. I've worked with some young women who struggle with eating disorders, being next to the dining hall and being next to the good dining hall. Sometimes having a single so they could eat quietly without somebody else watching them. So there's an Office of Disabilities that will help your student get extra time on exams if they have that in high school, will have accommodations in terms of the dormitory. Like I have worked with a young woman who had type 1 diabetes. She needed like a special refrigerator, she needed extra air conditioning. There's medical singles. I work with some kids who have insomnia. Sometimes being in a triple is really difficult in terms of sleep. So the universities are equipped to support your students for whatever special needs they have, and it is really important to get that settled before they arrive. It's just so much simpler. Every university has a mental health center and some college counseling, and a medical health center. In my experiences, those folks are excellent in emergencies. So if there's a crisis or an emergency, I think there's a lot of support and intervention, but it's usually a very small team servicing thousands of children. And you and I talked about it before the meeting, that sometimes it takes 3 or 4 months or 3 or 4 weeks to get a therapy session, and then there's a limit. There might be 5 sessions they can have or 10 sessions they can have. So if your child has ongoing psychological or psychiatric challenges and needs good care, it is important to probably get that care off campus and not to kind of expect the university to be able to provide it. It could be your home team if you're seeing a therapist who's able to practice in different states. Or it could be useful to kind of find boots on the ground and find a local team if it's important for your child to be seen in person, and also to check with your therapy and psychiatric provider to see that they're able to practice and treat your child when they're at school.
Excellent. Thank you. Allison, you want to take that as
Yeah.
well on yours?
I would also say, one of the things that I do with my clients is that I have a worksheet that we fill out so that we have everything just kind of literally on a piece of paper that the parent and the child has. Where is the counseling session center? How would you get an appointment? What other sorts of disability support is there? Are there groups? Do they have individual sessions? I recommend parents be active on the parent pages on Facebook. Many of the colleges, you can get a wealth of information, even if it's just, can you tell me a local neurologist? It may not be mental health. If you really do, if you're sending your child with a pre-existing condition, one of the things that you will often hear, especially children with IEPs, especially children with ADHD IEPs, will say is, I'm gonna not even bring my IEP with me. I'm ready. I want to prove that I can do it. Now is not the time to do that. It is really important not to do that. Bring your IEP with you. The physical IEP at one point does need to be mailed to colleges. Many colleges will honor the IEP. I believe that most colleges will honor the IEP, but I don't know that as a fact. But if you do have a child that does have a known mental health challenge that has been of some duration, particularly eating disorder, an eating disorder specialist who I have worked with, not me, said that she always says you really must make sure that you have arranged private counseling, because you need to know they are 18. They may not provide you with information, and sometimes the only way that you will know if your child is actually going to their sessions is by looking on the patient portal, which you can have access to since you're paying for it, and if you're getting the bills. So it's really important to be aware. One of the things that some parents do is they set up a release already, a medical and psychiatric release before their child even goes, and they have that on file at the university. It's highly recommended. And also, when I send the students my worksheet that I do that has all of these names and numbers, as well as just talking about with the parents, and I try to have a session with the child and the parent before the child goes to school, is what's our expectation about how we're going to communicate about these sorts of things.
Yeah, no, that's That's actually, I guess I almost realized that we probably don't have the medical proxy or medical something that they call it. We should um, go and address that maybe for our parents to know that there is something like this, we can really do it. So maybe in a different session or something, but that's an important thing that we tend to forget. So one quick question about, I know you guys have been talking about IEP. So let's say if a child did not have an IEP in high school, but they do have a diagnosed disorder, maybe recently or whatever. How are they, like, can they just go and take the test results to the college and they can get IEP started over there, or do you
So
know if
it's
what is the process?
it is more likely that they would get a 504. IEP and 504 come out of different laws. The 504 comes out of the Americans with Disabilities Act, and it's a medical disability. ADHD is considered a medical disability, but so are mental health issues. IEPs tend to be more about learning challenges and come out of a different. The law is called IDEA, and it's just different. Um, if your child does not have an IEP already, the chances of them getting one in college would be harder because as a requisite for an IEP is that you have to demonstrate that it has shown academic, it is it creates academic challenge.
Academic struggle or academic
Yes,
challenge?
yes. So the
Yeah, I
fact that your
got it.
child's already in the college, it would make it harder. It would be much easier to get a 504, which requires a diagnosis and recommendations from a doctor. And although most universities, I mean, they're not required by law to abide or to give you a 504. Everybody will. Nobody is going to deny a 504. So it's a little bit easier to get.
Yeah, I would say in my experience, in working with helping high school students get accommodations and college students, I actually think getting accommodations in college is easier than in high school, and I think it's easier to get. I don't even know if it's called a 504. I think they just call them accommodations, and
Accommodation.
I think that, like for example, it's very hard to get your student extra time for a diagnosis of depression or anxiety. You know, I've often worked with kids who have terrible obsessions and compulsions or checking their answers over and over and running out of time. And I have had a difficult time getting them extra time in high school because the criteria is really strict, where sometimes the high schools are always worried that parents are trying to game the system. And so accommodations for extra time are only given to kids with a definitive ADHD diagnosis and a neuropsychological examination. I find that when my patients apply for accommodations, that might include extra time on exams, taking exams in a private room, having flexibility with rescheduling an exam or an assignment without penalty. For example, I work with some students diagnosed with bipolar disorder, and there are times where they don't sleep and they may spend 2 nights not sleeping. I think for them to take an exam the following morning seems like a tremendously unfair disadvantage. So usually they fill out an application for accommodations. I submit a letter of proof with my suggestions. And I have found that almost 100% of the time, the university accepts my recommendation, is more than happy to accommodate the student. Whereas I would say if I'm dealing with a high school child study team, that probably
May
occurs
not
about
happen.
30% of the time,
Much
much less
quicker.
frequently.
That is
So I,
actually. I have one last question. I'm sorry to cut you off, but we
please.
are almost towards the end. But I do have this last question because it's an important question. How does the across the, because most of the students, New Jersey is a small state, there are very few colleges here. How does the care look like when students go from across the state, whether it is New York, Connecticut, California, Midwest, South, whatever? How do we, if they have a therapist already or the psychologist already here, or if they are feeling like we already spoke about it, that maybe if there is a episode, or if they need some help or support, college might not be, the college counseling team can be temporary, very, very temporary, but you have to look for help. How does that look like? Do they have to look at there where the parents have no clue, or can we get the help from New Jersey?
So there are some. I'll be really quick. So there are some therapists that are able to practice across states. So I, as a clinical psychologist, I'm a member of something called PsyPact, and there's 42 states that are in this pact, and so I can treat kids in almost every state minus California and a handful of other states. So for some of us, there's a continuity of care. That becomes a little trickier with psychiatry. I think psychiatrists and nurse practitioners don't have that flexibility. And so sometimes they will see kids when they come home and visit, and the parents maybe will bring the medication to them. And sometimes it might be important to find a treatment team and do a little bit of research and find some private care at a local clinic, private practice, or therapy, the same way we would be doing research when finding a child for us to be seen by someone in New Jersey.
Thank you. Alison, is that the same thing with the licensed I guess licensed clinical social worker, or the
Social workers are
licensed?
about social workers are about 4 years behind psychologists. You've had PsyPact. I don't know what year it happened,
Since
but
COVID, I
yeah,
think since
since
COVID,
COVID.
yeah.
But what we have been doing is getting ourselves licensed in multiple states, which is a real pain. And that's what I do. But starting at the end of this year, the Social Work Interstate Licensing Compact is going to go live. At this point, there are, I think, 40 states that are in it. So that's in 2026. It's going live. It's 2026. At the end of this year, it's going live, and that'll be a lot easier for me. And at this point, it is something that I would say if you are really concerned, you know, starting with somebody at the university, the thing to think about is most of the children from this area are going to large national universities if they're going out of state. Some of them are going to small liberal arts colleges, but most of the children from this area are going to universities and colleges that are accustomed to serving students from our area. New Jersey sends the most
Right.
students anywhere. It's not like you are a local student in Indiana going to a smaller Indiana state school. Your chances are you're going to be going to Indiana University.
Yeah, how
Those
you?
schools are sophisticated and have setups. I do agree that it's important to think about the local counseling center that's a part of the university as like a front door, not as the house.
Yeah.
But
Yeah.
they frequently can refer because they have a network there that they
They
know.
have lists, yeah.
Yeah.
They may be
Okay.
able to help you set up your team as well.
Thank you. Thank you so much. I think it has been an amazing discussion for me. One of the key things that I obviously picked up, and that is something very interesting, Alison, that it's okay to struggle, not to suffer.
Yes.
And that really, I think it has to really come to me as well, as I feel like it's an important message for everybody. And overall, it was an amazing discussion. I would send you any questions if I do get them, but otherwise, thank you so much for your time.
Thank you
We
for
are
having
really
us.
grateful for this, and it was an amazing discussion. I hope that most of the people who are listening in, this was a good start. But if there are any other follow-up questions, we would get them. This was the last panel as part of the Youth Mental Wellness Fair that is supposed to happen this Sunday, which I am holding my fingers tight, but there is a possibility, and anybody who is hearing it, listening to this, there is a possibility because of the impending snowstorm, we might have to move the fair to next Sunday on February 1st, and we will take that call on Friday, this Friday. But Have a great night, everybody, and thank you again.
Thank you so
Thank
much. I
you.
really
Have a
enjoyed
good
this. It was
night.
so nice to meet both of you.